I'm going to show you our cervical retraction isometric exercise. So this is a great exercise to build off of our cervical retraction head lift, just to build some strength and endurance in our neck. Primarily, I strengthen the neck by doing traditional upper body strength, pulling, pushing, pressing, carrying, crawling, all with that neutral neck focus. But this can be a nice adjunct, especially if you're having some neck pain. So this is a pull-up assist band. This is like, I don't know, the 30 to 50 pound. Purple's pretty similar color for this. Obviously, you can start lighter. You could use a TheraBand. If you don't have a sturdy post, you can do a knot and anchor it in the door. So you're gonna come through here, get it on the base of my head. I do want it anchored a little higher there. Great. And so ideally this would be pulling straight. I'm gonna get a nice chin tuck and tall and retraction. And then I'm gonna walk back into tension. And then I'm just trying to sustain that. I'm tucking my ribs down so I'm not cheating there. And I'm just sustaining this for time. I can sustain this for 30 seconds, or I could walk back in, walk back out to kind of learn to build that tension and then turn it down, making sure I'm not cheating. And I could do anywhere from, typically 5 walkouts back and forth. It's gonna equal about that 30 seconds. So that is our cervical retraction strength. You can further build this strength with our isometrics for rotation and side bend. We tend to primarily strengthen in isometrics because we don't do a ton of resisted head movements. So there's a place for some of that stuff, but typically we strengthen in isometrics. So I hope that's helpful. Typically I would do 3 sets, 3 times a week in a rehab phase or an occasional performance phase, but primarily I'm strengthening with all of my other complementary lifts as I mentioned. So I hope that helps.